Welcome to Health Talks with Only My Health. Cardiovascular diseases have become the #1 cause of mortality in India. While most people are aware that chest pain is a common symptom, they do not know of the other symptoms. Today, we have with us Dr Nishith Chandra, Director Interventional Cardiology, Fortis Healthcare, who will tell us ways to prevent the disease. Dr Chandra, welcome to Health Talks. Dr Chandra, so what exactly is coronary heart disease?
Now, coronary heart disease is a very common disease of heart, and in this what happens is the heart arteries which run on the surface of the heart, they get blocked. Now, what is the function of these arteries? These are the arteries which supply blood to the heart musculature. Now, when they get blocked, then the heart muscle receives less blood supply and the person starts having either angina, breathlessness, or in the final stage, a heart attack. The main cause of the blockages is the increased cholesterol, which leads to plaque buildup and reduction in the blood supply to the heart muscles.
Okay, that explains it well. So what are the risk factors for coronary artery disease?
There are lots of risk factors. Some risk factors are modifiable, that means which you can control it, and there are certain which are non-modifiable, means you don't have control over those risk factors. First, the non-modifiable risk factors. The non-modifiable risk factor is age. Like in males, it is more than 55 years of age, and in females is more than 60 years of age. Then males' sex. Males are more prone for heart attacks as compared to females. Then family history of heart disease. If anybody in your family, like your father, mother, or uncles, have had a heart disease at a younger age, then you are at a higher risk of developing heart disease. So these are all factors which you cannot control. But if these factors are there, then you should be cautious right from your early childhood, achieving better lifestyle to reduce these risk factors. Now, the modifiable risk factors means the risk factors which you have control over, like smoking. You should not smoke. Development of diabetes. If you have developed diabetes, then you can get it treated, have an adequate control of blood sugar. High blood pressure, obesity, and now it is a very common risk factor which is occurring is sedentary habits. Even now we call it sitting is the new smoking.
What symptoms are typical of a heart attack?
Now, the commonest symptom for a heart attack is an excruciating chest pain on the left side or in the center of the chest, associated with sweating, intense weakness, and sense of impending doom. But sometimes these symptoms are not there. So you can have atypical symptoms like intense weakness, sudden vomiting. So the heart attack can present in a variety of symptoms. But if you are having risk factors for developing heart disease, which I have already enumerated, then you should be cautious of sudden change in your symptomatology like excessive weakness, breathlessness, and if it is associated with chest pain, then you must see your doctor immediately.
Dr. Chandra, what should be the ideal blood pressure reading for a healthy person?
Now, you all must be knowing it that the ideal blood pressure reading is 120 systolic and 80 millimeters of mercury diastolic. But this is a level at which we don't start the medication. The upper limit of normal, beyond which we have to start medication, is 140 systolic, which is the upper reading, and 90 millimeters of mercury, which is the lower diastolic one. So beyond 140 and 90, we have to start the medications for treating blood pressure.
What do the fluctuations here indicate?
Now, blood pressure and heart rate and all these parameters, they are bound to fluctuate. But there is a normal range. So there is no static blood pressure always. Depending upon your circumstances, your outside circumstances, the blood pressure will fluctuate. Any stressful situation would lead to increased blood pressure. When you are relaxed, when you are sleeping, blood pressure will fall. But all these parameters have a normal range, below which and above which then we have to treat.
And what are the common heart attack warning signs? Are they different for men and women?
Now, as I told you earlier, the heart attack warning signs are a person who is having first pain or discomfort in the chest on exertion. Like earlier, if he used to walk a kilometer without having pain and now he's having pain even after walking half a kilometer, then this is a warning sign. A person who starts having breathlessness while climbing stairs or even walking, then this is again a warning sign. In addition, if he has all those risk factors like diabetes, smoking, hypertension and sedentary habits, then these warning signs should be taken seriously.
So when should the doctor be approached? And what medical aid can we provide the patient before reaching the hospital?
Now, in heart attack, every second counts, because every second delayed means your heart muscle will be irreversibly damaged. So as soon as you start suspecting having heart attack, then the first thing you should do at home is take an aspirin, dissolve it in a half glass of water and drink it. This is not for alleviating pain, but it is a blood thinner. It is an anti-platelet properties which reduces the coagulability of the blood. Don't go to a nearest hospital, because there you will be delaying the treatment of heart. So you must identify the nearest heart hospitals in your residence or workplace and rush to that hospital in a case of a heart attack.
This information will be really useful, doctor. Now my next question is that belly fat is associated with a higher risk of heart attack. So do the risk factors vary in men and women?
Now you have very correctly said that belly fat is a risk factor for heart disease. It's the abdominal obesity which indicates that the person's body fat is much higher, and this fat is more dangerous for developing heart disease. So the good point is that we can easily measure what is the abnormal belly fat. In males, more than 40 inches, and in females, more than 35 inches of waist circumference is a risk factor for developing heart disease.
Doctor, once in the hospital, what tests are done to determine the condition of one's heart?
As soon as the person reaches the hospital, the first test to diagnose a heart attack is an ECG, is a 12-lead electrocardiogram, and certain blood tests, which we call it cardiac enzymes like troponin T or CPK-MB. These tests, they confirm the diagnosis of a heart attack. And in addition, nowadays we do a bedside echocardiography also, which shows the heart on the screen. It's basically an ultrasound of the heart, so we can see exactly the amount of damage heart attack is doing to the heart muscle, what is the status of the valves. So these are the three tests: ECG, troponin enzymes, blood tests, and the echo. They confirm the diagnosis immediately. And then we have to send the patient immediately for either clot busting therapy or for primary angioplasty, or which we call stenting.
Doctor, what happens during angiography? Can you please explain the procedure?
As I have told you that the reason for heart attack or angina is the blockages of coronary arteries. So any person who is having those symptoms means there are blocked arteries. So we have to define, we have to diagnose those arteries, what is the nature of blockages, what is the severity of blockages, and which all arteries are blocked. So for that, there is a simple test called coronary angiography. Now this angiography is done in a cath lab. It is not an operation. It's a simple procedure. When a patient lies on a table, we don't even give general anesthesia, and that patient is fully awake. We insert a very small 2 to 3 millimeter tube inside his groin or in the radial artery of the arm and enter the heart. And then we inject a radio opaque dye, and the video camera then makes a film. Wherever there is a blockage, the dye will not go, and which will appear as a black shadow on the screen. And that is how we diagnose the blockages. So coronary angiography is a very safe procedure nowadays. It takes only 10 to 15 minutes on the table, and nowadays we are doing it through the radial route, so person can go home after 2 to 3 hours.
What is angioplasty and how is it done?
Now, angiography is a test only. It is like a diagnostic test of how many arteries are blocked and where they are blocked, how severe the blockage is. Angioplasty is its treatment. In common parlance, we call it ballooning or stenting. So in these angioplasty, what we do is we insert from the same groin or arm, we insert a catheter, guiding catheter, or over which we thread a small wire which passes across the lesion and across the blockage, and then we inflate a very small tiny balloon of 2 to 3 millimeters dimension, which makes the room for the next step, which is stent placement. So once we make a room passage in the blocked artery, then we put a stent, which is a mesh spring-like structure, very fine metallic spring on which drugs are coated, so which reduces the occurrence of re-blockages later. So nowadays very good stents are available, and the restenosis or re-blockages rates have become very low.
What is congestive heart failure and how is it different from a heart attack?
People often confuse heart failure with heart attack. These two terms are totally different. Heart attack means when the arteries of the heart gets blocked and there is less blood supply to the heart muscle. This is called heart attack, and the symptoms are severe chest pain or breathlessness. While heart failure is when the heart, which main action is pumping. So when the heart fails to do its action, which is pumping adequately, this is called heart failure. Means heart is failing to pump enough blood supply to the different body organs. The first and commonest symptom of heart failure is breathlessness. When a person starts exercising or going for a walk, he starts having breathlessness. Or at the later stages, if we don't treat it, the person will be breathless while lying down. He has to get up in the middle of the night. So this is a symptom of heart failure. These two, heart failure and heart attack, are totally different terms. Though heart attack, if not treated in time, will ultimately lead to heart failure.
Dr. Chandra, these days we see a lot of younger people complaining of heart diseases. So what can one do to reduce the risk?
Now, to reduce the risk of developing heart disease is you don't have to start in the adulthood or older age. You have to achieve good lifestyle changes right from the early childhood. And these habits are, instead of sitting on your watching the screen, televisions or iPads or your mobile, you have to go out and play outdoors, do aerobic exercises, do walking, gymming or cycling, or whatever sport, outdoor sport you can do, you should do that. If you are smoking, you have to quit smoking. If you are drinking alcohol, then it should be done in moderation. For moderation means 2 drinks for males and 1 drink for a female. And if you are overweight, when we say when the body mass index is more than 25. What is body mass index? It's a ratio of height and weight. So that is, if it is more than 25, then this is, you have to reduce weight.
Dr. Chandra, thank you for being with us. The tips you have shared will go a long way in saving many lives. Thank you once again.
Thank you very much.